Doctor, earlier, you mentioned a little bit about vaginal dryness. What are the effects of this, and how can this really be addressed?
Okay, there are various causes to vaginal dryness. The commonest reason I see in this country in younger women is the fact that women use vaginal washes, feminine wash, and intimate wash and things like that. The vagina is self-cleansing, right? And there's no reason to use any form of soap or things like that, because if nature meant the vagina to be smelling of roses or lavender, it would have designed it to be that way, a bit of roses. But it's not meant to be that way. It's not meant to be overwashed and watered too much.
Yeah.
And that is the biggest reason why you have dryness. And as a result of the dryness, you get pain during sexual intercourse. And as a result of that also, of the dryness, you get recurrent infections, vaginal infections, such as candidiasis, thrush, bacterial vaginosis, and things like that. And that actually makes the problem even worse.
That's true, doctor. There are, a lot of articles these days circulating about, vaginal steams and vaginal masks and bleaching. It's become all the hype for women to really try and make, I don't know what they're trying to do. What are your thoughts on all this?
Well, I'm against all of this. As far as I'm concerned, it's self-cleansing, and you should limit washing to once to twice a day. What I find is that Malaysian women tend to wash every time they go to the toilet, and then then they use tissue paper, and then you get tissue paper being stuck and all that. That's a source of infection. So what I'm trying to say is that none of this is necessary. Limiting your washing to once or twice a day when you're having a shower is more than enough, and not the inside, not the inside lining of the vagina. That's where the protective bacteria is, and if you're going to remove that, then you're not going to have any protection, and you're going to have recurrent vaginal infections.
There's also a certain pH balance that needs to be kind of maintained.
That's right. It has to be a low pH balance. That's right.
All right. And what about the use of panty liners?
Yes.
Some women wear it, or even pads and tampons. They
Yes.
wear it for too long.
That's right.
Some women wear those that are super absorbent.
That's right.
So what are your recommendations with
Yes,
that?
I'm a fan of panty liners. I tell my patients who have this urge to wash every time they go to the toilet to use panty liners instead, not the scented ones, and then just put them on, and then one for the day and one for the night, and that should solve the problem. That is if they have recurrent infections and things like that, and that's one way of doing it. Of course, antifungal therapy would be another way to prevent all those infections. But definitely no scented panty liners, no synthetic underwear for long hours of the day. Tampons, definitely, if that's a trigger, definitely not use it.
Speaking of vaginal dryness, one of the remedies was said to be a kind of treatments of estrogen levels or testosterone levels, and a lot of women are very apprehensive on using these treatments to kind of get rid of their issues. What do you have to say about all this?
Yeah, it depends on the age group of the women. Younger women shouldn't have a problem. Testosterone is there to in fact, keep vaginal health, to maintain vaginal health.
Yeah.
So you're going to have enough estrogen and testosterone in you to maintain vaginal health in a younger woman. An older woman, as you're going through the perimenopause and the menopause, that's different. You're going to have vaginal dryness. You're going to have a low estrogen state, a low testosterone state. So therefore, some form of topical estrogen, which is estrogen locally, that at the level of the vagina, would be highly beneficial.
All